What is the Autism Spectrum? By Lauren Nelson. As a current or future teacher that is looking to educate students in an inclusive classroom containing autistic students, it is highly important that one know the basic details of each part of the autism spectrum. Since the disorders are part of a spectrum, details regarding symptoms, usual behaviors, and the diagnosis range far and wide. The autism spectrum contains three main branches: autistic disorder, Asperger's syndrome, and pervasive developmental disorder not otherwise specified. Each branch has its own set of differences. However, there are commonalities between all three. According to the National Institute of Mental Health, all children with autism spectrum disorders demonstrate deficits in social interaction, verbal and nonverbal communication, and repetitive behaviors or interests. Each child's communication, social, and behavioral patterns will manifest themselves differently, yet will still fit the overall diagnosis. The Diagnostic and Statistical Manual of Mental Disorders, 4th edition, is the main book psychologists and doctors use when making diagnoses of different disorders in the autism spectrum. This book is published by the American Psychiatric Association. According to the Autism Society, the DSM-4 helps mental professionals differentiate patients within the autism spectrum. Since the symptoms can range from mild to very severe, levels of developmental signs will manifest differently in each person. Typical symptoms will show themselves in all aspects of the autism spectrum. From inappropriate emotions to difficulty interacting with others, the autism spectrum truly is what it says it is, a wide spectrum. This is something that needs to be emphasized. Each case of the autism spectrum is unique, but there are defining traits that characterize each part of the spectrum. The first branch of the autism spectrum is autistic disorder. Students with autism will display the most symptoms in the spectrum. Autism likely presents itself in early childhood. Autistic disorder is characterized by language and verbal or nonverbal communication impairments, social interaction impairments, and odd pattern behaviors or interests. In addition, mental retardation, seizures, and sensory problems can also be present in students with autism. The second branch of the autism spectrum is Asperger's syndrome. While students with Asperger's will display some symptoms similar to that in autistic disorder, instead they will show relatively normal language and communication developments. Students with Asperger's may appear to be like every other student, yet instead will show signs of abnormal interests or behaviors as well as some social difficulties. The final branch of the autism spectrum is pervasive developmental disorder not otherwise specified. According to the Autism Society, a child may be diagnosed as having PDD-NOS if he or she has some behaviors that are seen in autism, but does not meet the full criteria for having autism. However, treatment for the disorder or behaviors is often much more important than finding a name to give the patient's behaviors. Treatment of PDD-NOS is very similar to the treatment of any other ASD. Although there are many disputes about the early diagnosis practices for ASDs, the earlier a diagnosis occurs, the earlier treatment can happen. In order for a child to be diagnosed with an ASD, they must first be screened for developmental characteristics by the pediatric doctor. This screening should already be a routine procedure, and the observations of parents will often be the key to noticing oddities in the developmental process. Following the pediatric screening, children who are thought to have an autism spectrum disorder will go through a second part of the diagnosis, a comprehensive diagnostic evaluation. This ensures that they will accurately rule in or rule out an ASD or other developmental problem. This part of the diagnosis will include genetic testing, neurological assessment, and detailed cognitive and language testing. This thorough evaluation may be done by a multidisciplinary team that includes a psychologist, a neurologist, a psychiatrist, a speech therapist, or other professionals who diagnose children with ASDs. Once diagnosed with the disorder, treatment for the child can begin. According to the National Institute for Mental Health, there is no single best treatment package for all children with ASDs. For more information on the treatment options available for children and students within the autism spectrum, please read Diane Burkell-Zager's Autism: Identification, Education, and Treatment. Remember, not one student with an ASD that you encounter responds or acts exactly similar to another student with an ASD. Symptoms and characteristics range from very mild to very severe, so be sure to approach each student like they are unique. After all, the disorder is only a label and does not make who they are.